What if I told you that the earliest warning sign of a future heart attack is not chest pain, but a quiet frustration in the bedroom? Yes, I'm talking about vascular health. The most petite and most delicate arteries in the body located inside the penis are often the first to be affected by atherosclerosis, blocking blood flow and stealing away the confidence and intimacy you once cherished. I am Dr. Laura, a urologist with over 30 years of experience helping men across America restore their vitality. In my clinic, I have listened to the stories of countless men in their 60s, 70s, and beyond. They don't speak about manhood itself, but about a more profound fear, the fear of losing the intimate bond with the partner they love most. And here is the astonishing truth. Most of them turn to temporary fixes such as pills, pumps, and expensive procedures, while ignoring a solution that addresses the root of the problem. That solution lies in 4 specific vitamins' essential nutrients with the power to restore arterial health from within, bringing back the natural strong flow many believed was lost forever. In this talk, I will reveal exactly what those 4 vitamins are. But listen carefully because one of them is so often overlooked that most men only realize its importance when it is nearly too late. And that is something I do not want you to miss. Before we dive into the details, if this message resonates with you, I invite you to click subscribe and the bell icon beside it. This is more than just a click, it is a decision to prioritize your health and happiness. That way, you won't miss any of the vital information we will be exploring together. And I genuinely want to hear your story. Even if it's just a greeting or a brief thought, leave a comment below. Every comment is a message of encouragement, a reminder that none of us is walking this path alone. Now let's talk about the foundation of vitality, the first vitamin, and one that is often overlooked. We are not just talking about bones or a few minutes of sunshine. We are talking about something that has a direct impact on testosterone, vascular health, and ultimately your ability to enjoy intimacy after the age of 60. That vitamin is vitamin D. When an older patient walks into my clinic looking exhausted and telling me he doesn't feel like himself anymore, my first question is usually not about the medications he's taking. Instead, I ask, what is your vitamin D level? Most are surprised. They think of it only as a bone vitamin. However, the truth is that vitamin D functions like a prohormone, a master switch for testosterone production, and the health of the endothelium, the delicate lining inside your arteries. Without adequate vitamin D, the endothelium becomes damaged. It cannot produce enough nitric oxide, the molecule that allows blood vessels to relax and improve circulation. The result is stiffer arteries and declining desire. This problem is widespread in older men. Your skin no longer produces vitamin D from sunlight as efficiently as it once did, and your diet rarely provides enough. As a result, levels silently decline year after year. I will never forget the case of Mike, a retired Boston firefighter. He came to see me deeply frustrated, having tried many methods but failed to regain his natural confidence. His lab results showed his vitamin D was alarmingly low. The transformation after proper supplementation was remarkable. A few months later, he returned not only to thank me for the improvement in his intimate life, but for something far greater. He said, Doctor, I finally feel like myself again. I have the energy to go hiking. I feel happier. I feel alive. That is the quiet power of vitamin D. It not only supports bones, but also supports the very essence of humanity. For optimal results, most men should aim for blood levels between 40 and 60 ml. This typically requires a safe daily supplement of 2,000 to 4,000 IU. However, you should always consult your doctor to determine the correct dose for you. Sunlight is beneficial, but after the age of 60, supplementation is almost always necessary. It's important to note that excessive vitamin D intake can lead to toxicity, so it's crucial to follow your doctor's advice and not exceed the recommended dosage. And if vitamin D makes your blood vessels more flexible and resilient, the following vitamin acts like a professional cleaner sweeping away the stubborn plaque that has built up over many years. Let's talk about vitamin B3. Keep in mind that these supplements may come with a cost, so it's essential to consider this when planning your health regimen. Next is vitamin B3, also known as niacin, the nutrient with the power to unclog. When a man comes to me worried about his performance in the bedroom, society often points him toward a strong and immediate solution. But I suggest something much more innovative. Niacin, a water-soluble vitamin, is recognized for its role in reducing cholesterol levels and promoting heart health. However, it also has a lesser-known benefit for men's health. What they don't expect is for me to ask about niacin. For decades, I've seen how this simple nutrient can make a profound difference in circulation energy and intimacy. Niacin works by sending signals that cause the tiniest blood vessels in the body to expand. You can actually feel this process as a wave of warmth spreading across your skin, something known as the niacin flush. This is not a scary side effect. It's a positive response from your body, a sign that blood is flowing into areas that were previously constricted. Think of it this way: over the years, plaque has gradually built small dams inside your arteries. Niacin doesn't break down those dams with force. It opens the floodgates, allowing blood to surge freely once again. For men, that means better circulation to the heart, better circulation to the brain, and of course, better circulation to the penis. I think of Mr. Harrison, an engineer in his 60s, logical and scientific in everything he did. He carefully controlled his diet and exercise, yet his cholesterol kept climbing, and his confidence in the bedroom kept falling. He felt powerless. We carefully added niacin to his regimen. Just a few weeks later, he returned and told me, "It feels like a room in my soul, one I thought had gone dark forever, has been lit again." The beauty of niacin lies in its double benefit. It doesn't just expand blood vessels for immediate impact, it also balances cholesterol over time, lowering LDL, the bad cholesterol, and raising HDL, the good cholesterol. This helps clean and protect your vascular health for years to come. Of course, niacin must be used wisely. Effective doses typically range from 500 to 1,000 milligrams. However, it is not recommended to experiment with this dosage on your own. Starting niacin should always be done under medical supervision, especially if you have underlying conditions. But even after the pathways are cleared, another silent threat appears: calcium buildup. The very mineral that makes bones strong can become your enemy when it hardens inside artery walls. And that's where we need the body's traffic controller, the next vitamin that ensures calcium goes precisely where it belongs. Now let's talk about vitamin K2, the nutrient I often describe to my patients as the body's traffic officer. Its role is absolutely vital, yet it is one of the most overlooked factors in men's health after the age of 60. Vitamin K2's job is to direct calcium to the right place. When calcium is guided into the bones, it is your best friend, strengthening them and preventing fractures. But when calcium goes astray and deposits inside the arterial walls, it becomes a dangerous enemy. It causes your blood vessels, meant to be soft and flexible, to become stiff and brittle like cement pipes. Once that happens, blood flow becomes blocked, and achieving an erection becomes nearly impossible. I've seen far too many CT scans showing severe arterial calcification. I think of Charles, a gentleman in his 70s, who tearfully confided that he felt he was letting down his wife of 50 years. His test results showed that his heart was overworking, primarily due to calcium buildup in his arteries. We added vitamin K2 to his regimen. Over time, not only did his numbers improve, but an even greater gift returned intimacy and laughter in his marriage. The science behind this is astonishing. Vitamin K2 activates proteins that pull calcium out of soft tissues and blood vessels, then anchor it into the bones and teeth. Without vitamin K2, calcium can float freely and cause harm. With enough vitamin K2, your arteries remain elastic, ready to expand and welcome strong blood flow when needed. For most men, getting enough vitamin K2 from diet alone is very difficult. That's why supplementation is often essential. The most effective form is MK7 with a safe daily dose of about 100 to 200 micrograms. It works best when paired with vitamin D, making a perfect duo. One expands, the other keeps clean. However, even when blood vessels are flexible and calcium is under control, there is still another invisible enemy attacking your vascular health every single day. That enemy is oxidative stress. And to fight it, we need the final protector in this quartet. Let's talk about vitamin C. Finally, let's talk about the silent protector of the circulatory system, vitamin C. When most people think of vitamin C, they think of preventing colds. But for me, when it comes to blood flow, in men over 60, vitamin C is the master repairman of your arterial walls. Think of your arteries not as smooth pipes, but as a finely woven fabric of collagen fibers. Every day, oxidative stress frays those fibers, creating weak spots that make the arteries stiff and vulnerable. Blood that once flowed freely now struggles to get through. This is where vitamin C reveals its dual role. First, it is the builder and essential factor your body needs to produce new collagen, patching up damage, and maintaining elasticity in your vessels. Second, it is the bodyguard, a powerful antioxidant that patrols your system and neutralizes free radicals before they can cause harm. I think of Captain David, a retired Navy officer who always maintained discipline and good health. Yet he came to me in despair, feeling as though his body was betraying him. His diet was severely lacking in vitamin C. A few months after making adjustments, he returned and told me something I will never forget. Doctor, it's not just about the bedroom. It feels like the fog has lifted. I feel the flow of life has returned. To achieve this kind of protection and repair, a daily intake of 500 to 1,000 milligrams is both safe and effective for most men, whether through food or supplements if needed. Consistency each day matters far more than a single high dose. And this is where everything comes together. These 4 nutrients work like a professional team. Vitamin D awakens the flexibility of your blood vessels. Vitamin B3 facilitates stronger blood flow. Vitamin K2 removes the dangerous calcium blockages. Vitamin C helps repair and protect the walls of the vessels. This combination is not just about restoring a function. It is also about enhancing it. It is about giving a man back his confidence, allowing him to reconnect with himself and with the partner he loves. We now hold the blueprint, the 4 pillars that can rebuild vascular health. However, even the most perfect blueprint is useless if it is never put into action. And that leads us to the most important step we will discuss next: how to turn this knowledge into practical action every single day. Now let's talk about the power of combination, a complete blueprint for circulation and intimacy. Over years of advising thousands of men, I've come to a profound truth. Real restoration never comes from a single silver bullet. The miracle lies in synergy, in the way solutions work together to rebuild what time has taken away. That is precisely what happens when you combine the 4 pillars: vitamins D, B3, K2, and C. Think of them as a team of specialists rebuilding your health. Vitamin D is the architect making the foundation, the blood vessels flexible and ready. Vitamin B3, or niacin, is the construction crew clearing and widening the pathways for free flow. Vitamin K2 acts as the safety inspector, ensuring that dangerous materials such as calcium don't clog the project. And vitamin C is the finisher, reinforcing and protecting the structure against daily wear and tear. When you understand this blueprint, you know why so many men report not only greater energy, but stronger erections and a sense of youthfulness they thought was gone forever. I think of Mr. Anderson, a retired principal. He had tried everything modern medicine offered, but still hadn't found what he longed for: most natural, dependable intimacy. We began patiently, 1 vitamin at a time. The change did not come overnight. But slowly he noticed he walked lighter, his blood pressure steadied, and his wife laughed more. And then, in those intimate moments, the fear of failure was gone. In its place was confidence and connection. When patients ask me, "How long will it take to see results?" I always tell them, this is not a sprint. It's rebuilding your house 1 brick at a time. You're not just restoring blood flow, you're restoring dignity, confidence, and joy. These vitamins are not a gimmick. They are the foundation nature gave us to sustain vitality. But the most critical question remains: how do you turn this powerful blueprint into an unbreakable habit that is the bridge between simply knowing and truly feeling the change? And that is what we will uncover together now. As we conclude this conversation, I would like to leave you with the most essential message. Society often tells men over 60 a story that loss of energy and intimacy is just an inevitable part of aging. After more than 3 decades of practice, I am here to tell you that is not the whole truth. Aging is real, but decline is a choice. What we've discovered today is this circulation is the flow of vitality and intimacy. When that flow weakens, everything else weakens with it. The blueprint we've outlined is not complicated. Vitamin D awakens vascular flexibility. Vitamin B3 opens the pathways. Vitamin K2 clears the dangerous blockages. And vitamin C repairs and protects the foundation. Working together, they provide what no pill can ever give you: a natural, sustainable foundation for health. The greatest joy in my work is not just watching lab results improve, it's also seeing the impact on patients' lives. It's when a man at 75 sits across from me with tears in his eyes and says, Doctor, you didn't just help me. You gave my wife back the man she married." For me, that says it all. Because intimacy is not a test you have to pass. It is a language you speak when words are no longer enough. It is about being fully present in your body, taking your partner's hand, and knowing you still have more than enough to give. So my final message to you is this: begin. Every day you take action is a day you give your body the chance to heal. Talk to your doctor, check your levels. Introduce these nutrients into your life with patience and care. The results won't come overnight, but they will come. And when they do, they will change more than your circulation. They will change the way you live, the way you love, and the way you see yourself. Gentlemen, age is not a sentence. It is a new chapter. And with the proper knowledge and the right action, that chapter can be the most vibrant one yet.